All right, today we're jumping right into the deep end with a clinical case that is literally a life-or-death puzzle. This is one of those situations where your gut instinct, the thing that seems most logical, could actually be the worst possible move. Let's get into it. So, picture this. You see a heart rate of 160. That's a siren going off, right? Every instinct in your body is screaming, slow it down. But here's the twist. What if hitting the brakes on that heart rate is the one thing that could send your patient over the edge? We're going to break down exactly why that is.
Okay, so Section 1, the case. The call has just come in, a patient is crashing, and the clock is officially ticking. Here's what we know right out of the gate.
Our patient is a 70-year-old man, and the big presenting complaints? He's not thinking clearly. That's what we mean by altered mental status. And he's incredibly weak. Now, these aren't just minor things. These are huge red flags that something is going systemically, profoundly wrong.
And then we get the vitals. Whoa, look at this. His blood pressure is 82/44. That is dangerously low. We're talking hypotensive. And at the same time, his pulse is hammering away at 160 beats a minute. You put those two numbers together, and they are practically screaming one word at you: shock.
So now we got to put on our detective hats, because these numbers aren't just random data points, they're telling a story. Each vital sign is a clue, and it's our job to piece them all together to figure out what is really going on.
And where's the best place to start looking for clues? The backstory. Luckily, the patient's wife is there, and she gives us some really critical information about what's been happening over the last few days.
And there it is, our first huge clue. He's had a fever and back pain for a few days. This tells us we're probably not looking at a sudden heart attack. This is pointing directly at an underlying infection. Could it be a nasty kidney infection like pyelonephritis, or even something in the spine? This is a game changer.
Okay, so we've got a likely infection. Now, let's connect that to what we're seeing right in front of us. How does that altered mental state and that rock-bottom blood pressure fit into this whole infection picture?
Well, that confusion and weakness, that's the body's way of saying its most important organs, especially the brain, aren't getting enough oxygen-rich blood. That's what we call poor perfusion. And that blood pressure of 82/44? Yep, that absolutely confirms it. This man is in shock.
Which brings us right back to our central mystery, right? If the pressure in the system is so low, why is the heart working overtime, beating at 160? It seems like it's going in the wrong direction, but trust me, understanding this is the absolute key to saving his life.
And here it is. This is the big reveal. That racing heart, it isn't the problem, it's the body's frantic solution to the problem. Think of it like this. The body is a sinking ship because of the shock. The heart is the one crew member left on board, bailing out water with a bucket as fast as humanly possible. The leak is the problem, not the guy with the bucket. The tachycardia is just the body's desperate attempt to keep blood moving.
So let's put it all together. You have a clear source of infection, you have dangerously low blood pressure, and you have a heart that's racing to compensate. All those clues point to one and only one diagnosis.
This is septic shock. The body is having such an overwhelming, massive reaction to an infection that it's causing blood pressure to just plummet, leading to organ damage. It is a true, time-sensitive medical emergency.
So we've named the enemy. Now, what's the battle plan? In septic shock, you have to act fast, and the protocol is actually pretty clear. Every single second counts.
It's basically a two-step attack. Step 1, fluids, and lots of them. See, in sepsis, the blood vessels get all leaky, and fluid just seeps out, so we need to pour in normal saline to refill the tank. Then, if the pressure is still low, we go to step 2, add a vasopressor, like norepinephrine. The best way to think about this is squeezing the pipes to get that pressure back up. So remember, fill the tank, then squeeze the pipes.
And hey, just so we're clear, picking norepinephrine isn't a random guess. It's the evidence-based, first-line treatment that's recommended in all the major guidelines for managing septic shock. It is absolutely the right tool for this specific job.
All right, now for what might be the most critical part of this whole case. We need to talk about what not to do. In these high-stakes moments, it is so easy to fall into a trap by just treating the loudest, most obvious symptom. And in this case, those traps are deadly. This chart lays it out perfectly. On the left is our patient's reality. The tachycardia is just a symptom of the shock. So how do you treat it? You fix the shock. On the right is the trap, thinking it's a primary heart rhythm problem. If you go down that path, you'll try to slow the heart directly, and that, well,
That would be catastrophic. Think about it. Giving a drug like adenosine or a beta blocker to slow the heart? That's like walking up to that poor guy bailing water from the sinking ship and telling him to take a 5-minute break. You take away the body's only coping mechanism, and the blood pressure will tank even further. And cardioversion? Totally wrong. This isn't a chaotic electrical problem. It's a normal rhythm that's just going really, really fast for a very good reason.
So, after all that, what is the one lesson, the single most important thing you need to walk away with from this case?
This quote from the source material just says it all, perfectly. The patient's tachycardia is a compensatory response, not a primary dysrhythmia. Let that sink in. The fast heart rate is the body's answer to the crisis. It's not the crisis itself. You have to treat the shock, not the symptom.
And that's what I really want to leave you with. When a patient is crashing right in front of you, the pressure to just do something is immense. But this case proves that the most important action you can take is to just pause for a second, look at the clues, and ask yourself that one crucial question. Am I treating the loud, flashy symptom, or am I treating the quiet, underlying cause? Because as we've just seen, getting that right is the difference between life and death.